My name is Deniz Bulja, and I'm coming from lovely capital of Bosnia and Herzegovina, Sarajevo. I'm currently at the position of head of Diagnostic and Interventional Radiology Department at this university hospital, and our hospital serves a population of roughly 600,000 people. So it's it's the major hospital within the Bosnia and Herzegovina. We are currently transitioning from the so-called primary stroke center to comprehensive stroke center. We have the capacities, and we started to implement mechanical thrombectomies as a way of treating acute ischemic stroke this year. My primary concern and maybe a primary issue is to raise the public awareness of mechanical thrombectomy and of stroke management as a standard of care for the patients that are unfortunate enough to have acute ischemic stroke due to emergent large vessel occlusion. So that's maybe the primary task for us to do. Then you have issue of medical staff who are not aware of how important actually the speed is in the process of treatment of patient with large vessel occlusion. And of course, you have medical staff within the hospital who are reluctant to actually change their behaviors by now. And these are actually the things that we are facing every day, and of course, we're trying to overcome it. I think we are facing the similar problems that Western Europe actually faced like 5 to 10 years ago, or maybe before. All these major RCTs came. So we are now we're now walking this path, and of course we will overcome all these obstacles. But it takes time, and the people who are actually involved in endovascular stroke care management are anxious to see it happen rather quickly. We organized the Sarajevo Stroke Forum, which was an ESMINT endorsed meeting. It happened, of course, in Sarajevo, and it gathered neurointerventionalists from Eastern Europe, along with neurologists and anesthesiologists, basically all the professionals who are involved in everyday practice of stroke management in every country. We also invited national health representatives, and this meeting actually yielded some results almost after the meeting. So procedure, mechanical thrombectomy, has finally become recognized, and it was possible to get reimbursement for this procedure by the clinical hospitals from the national health agencies. So it's maybe a small step, but for us it was a really major and final improvement in establishing of stroke care. We need to take additional steps in order to establish care or to get the results in pre-procedure. Also, the major step is actually education of neurologists, because radiologists already know how to perform their part of the job. But of course, there are also others involved in this, like neurologists and anesthesiologists, and we are trying to actually point their attention into this direction of specificity of stroke care management in this setting where, of course, mechanical thrombectomy is available. As I said in the beginning, we need to raise the awareness of the general public on the possibility for their treatment by mechanical thrombectomy, of course, if eligible, and in order for patients to demand the treatment, I think that's one of the major tasks that lie ahead of us. Of course, we are aiming to at least be comparable, of course, to Western European standards of practice, both in pre- and post-procedural care and within the specific field of mechanical thrombectomy and metrics related to mechanical thrombectomy.